Hello and welcome to our part of the conference. My name's Michelle West and I work for the NSPCC.
And I'm Spencer Bailey from Barnardo's.
And I'm Ray Tait. I'm an independent social worker who worked for the NSPCC until November 2021.
To give you an overview of what we're talking about today, we're going to explore the role and context of charities, the current charity sector provision in terms of harmful sexual behaviour services, the strengths and limitations of voluntary sector provision, working with children and families in response to sibling sexual abuse. We're going to pay specific considerations working with Black, Asian and minority ethnic or BAME children and families. We recognise that the term BAME is a contested term, but we struggle to find a term that encompasses all the different children, families from many different cultures and ethnicities. Best practice considerations will also be explored and future directions. Just to give you a little bit of an understanding in terms of why we're looking at charities, within the voluntary sector, charities form the largest area, and the voluntary sector itself is part of the third, what is known as the third sector. We'll be speaking about charities because of all three of us, of course, either work for a charity currently or have previously.
So before we look at the present day role of the charity sector services responding to sibling sexual abuse, we'll just take a really brief whistle-stop tour of the major charities, the history of the major charities, alongside legal developments that in relation to familial sexual abuse. So I'll refer to incest for a large part of this discussion, and that's recognise it's a pejorative term, but it's also a legal term that has been used in the law up until fairly recently, and incest specifically refers to intercourse rather than any other sexual behaviours, and it's primarily focuses on fathers and daughters. So if we look back towards the 16th century, Scotland was really considered as a forerunner in terms of the criminal law for incest, in which it incorporated the book of Leviticus, and it said, in which Moses said, "Thou shalt not discover the shame of thy sister." But at that time, it wasn't until 1908 in England and Wales that incest became a matter for state jurisdiction. Before that, in England and Wales, it was always a criminal offence, a religious offence. And Scots law was updated in 1986 and then consolidated again in 1995, but it still remains the same legislation today. If we turn to the law in England and Wales, it wasn't until the Sexual Offences Act of 2003 that the term incest stopped being used, and the law encompassed a much broader definition of familial child sex offences, but separately child sex with an adult relative as well, and that included in the child sex offences, it incorporated step siblings, half siblings, foster and adoptive siblings as well, and that was similarly updated in Northern Ireland in 2008. So if we look at the top line and look at the role of charities, they've played a central role really in influencing child welfare policy and practice, and specifically with sexual abuse and familial sexual abuse. So if we go to Thomas Barnardo, who opened the first children's home during Victorian poverty in the East End of London, he funded apprenticeships, and what his premise was is that he wanted the best start, whatever a child's background. And in 1884, it was the London Society for the Prevention of Cruelty to Children that later became the NSPCC, founded by Benjamin Waugh. And that had the NSPCC's had a real influence and role that led to the first Parliament for preventing Act of Parliament for preventing cruelty to children and promoting children's rights. And that was in 1889, the Children's Charter. And that really, for the first time, enabled the state to intervene in relationships between the parent and the child. And for a considerable time after then, it was the NSPCC that was responsible for responding to concerns about child cruelty. So anything that were any child cruelty concerns that came to the police in London was immediately sort of handled by the NSPCC. And the NSPCC retain in law some of those statutory powers today. We turn to the 1970s. In the UK, the rape crisis movement, or the women's movement, followed from the USA. Up until that time, incest was considered to be very rare and something that only sort of was the domain of psychiatry. But it was the rape crisis movement that really brought it to light and recognised through women's experiences that incest was a lot more common than what society wanted to believe, really. And it led to a lot of changes in the law, specifically rape in marriage, and also including oral and anal penetration in the definition of rape, but increasing recognition of incest or familial sexual abuse at that time as well. In the late 80s, the Cleveland scandal as well shone a light on child sexual abuse within the family. So child sexual abuse was no longer considered a stranger danger or exclusive to poor families. This was something that was happening across families in Cleveland at the time. And Bernardo set up the Bridgeway Project soon afterwards to provide therapeutic support to children affected by child sexual abuse. And that project still remains in place today. You might well be aware of the 1992 Commission report from the National Children's Home that was really influential on uncovering the scale and extent of sexual abuse by other children and young people. So instead of considering child sexual abuse as something that was just done by adults, actually children were a large portion of those who displayed sexual abuse and sexually abused other children. That report really recognised the role and the importance of the charity sector in providing harmful sexual behaviour services, and since then that role has continued. And around about that time as well, in 1992, the Young Abusers Project was founded by Eileen Vizard, and that's still in existence today as the National Clinical Assessment and Treatment Service. And if we move all the way to the present day, the Centre of Expertise for Child Sexual Abuse has really provided detailed research and practice development specifically in the field of child sexual abuse. And the Rape Crisis England and Wales Sibling Sexual Abuse Project has for the first time really sort of had a coordinated effort to looking at sibling sexual abuse within the UK and bringing it to public attention and the attention of policymakers as well. So if we look specifically at services for children and young people who have displayed harmful sexual behaviour, these are the main charities in the United Kingdom that provide a national service. So you've got the NSPCC, Bernardo's, Lucy Faithfull Foundation, and very recently the Harmful Sexual Behaviour Support Service for Professionals, a telephone helpline that's run by the Marie Collins Foundation and the South West Grid for Learning. Recognise that there are services specifically for victims of sexual abuse, including sibling sexual abuse, mainly from Rape Crisis England and Wales, Rape Crisis Scotland, and Rape Crisis Northern Ireland. But the focus of today's presentation is on services that respond to young people that have displayed harmful sexual behaviour to siblings. There are also some smaller regional charities and also non-profit organisations such as GMAP and charities that provide residential services for harmful sexual behaviour, such as Glebe House. So what we can see on the right-hand side is that most harmful sexual behaviours are at a tertiary level, specialist services, providing specialist assessment and intervention. There are an increasing number of primary preventative services, and that's such as the NSPCC Speak Out, Stay Safe assemblies in schools for general child welfare and child recognition of child abuse, and the PANTS rules, which is a preventative service for child sexual abuse. And also we have the Together for Childhood child sexual abuse preventative service in Plymouth. It's run by the NSPCC. But there's much less really at the secondary level looking at early intervention where there are relatively low level problematic sexual behaviours and stopping them becoming a problem early on. That's really a gap in current provision. So we want to look at some of the strengths that we believe that the charity sector can provide to harmful sexual behaviour services, and in particular when working with sibling sexual abuse. So the charity sector is really able to provide take a flexible and adaptable approach when working with families, and that can really help and bolster a whole family approach that we know from research is the most effective way of working with families when sibling sexual abuse has taken place. Also, there's considerable focus on partnership working in collaboration with other services. And for example, at Bernardo's, the service that I work at, we work jointly with youth offending teams, the NCAT service in NSPCC service in London that provides national consultation is an NHS, a joint service with the NHS. If we look at income, sometimes some charity services have extra pots of money or that might come from public donations, and that can really make inroads when we're working with families. When you're able to go out and buy them a new bed, a new fridge freezer, or furnish a room, that practical support can have an immediate tangible effect on a family during the crisis point, really. If they suddenly have to separate two siblings' bedrooms and they don't have anything to furnish the room, if we can really provide extra funding or actually provide the bed or the furniture that they require, that's a real positive impact on the family straight away, and can really help them in the work that you do. And that's something that families have said has made a noticeable improvement. Recognise that that we have a specialist role. Rather than being a generic service, we can really develop a specialism over many years as a niche area of practice in harmful sexual behaviour, but also as a subject specialist for sibling sexual abuse. And that's really important in the area where it's a complex and challenging area of practice, and you really need those years of experience to develop and build up and to be able to confidently give recommendations and provide a thorough assessment as well. And charities are recognised as well for being more trusted in some respects than other organisations. But for charities in particular, like Barnardo's and the NSPCC, they're very well-known names, and usually families recognise those names, and that can really start you off on a good footing with families. And you also have that independence from statutory sector provision as well. Whilst we do have a safeguarding role, it does mean that we are able to perhaps have a bit more balance, and where perhaps you're a bit less, appear to be a bit less threatening to families as well. And if we come to advocacy, we've got a wider advocacy role, I think, in terms of child welfare, child sexual abuse, and perhaps we need to do a bit more for sibling sexual abuse, and that's with charities campaigning, awareness raising, and public policy and TV adverts. But for families in multi-agency meetings on a much smaller level, that specialist knowledge and independence from statutory services means that we can advocate for what's best for families, rather than being confined to resource provision, and that really helps families in those respects as well. And a lot of the teams that we work with, our charity teams, are multidisciplinary as well. So we'll move on to so if you want to summarise the strengths of charity sector provision, we'll just turn to the work of Bourdieu, who talked about forms of capitalism, and that's just a really simple sort of paradigm or a concept to look at how the strengths of charity sector provision with sibling sexual abuse can take. So we can have cultural, social, economic and symbolic forms of capital. And we'll look at the limitations. So compared to the statutory sector, we do have a lot less influence. So whilst we can make recommendations for decisions about contact or living arrangements, it's ultimately usually the child protection social worker that will have that final say, or whether it's in the child protection conference, if it's in that arena. So we always try and make sure that the professionals don't look at sibling sexual abuse through an adult lens. They don't look at it as the same way as adult perpetrated intrafamilial abuse, but ultimately it's the decision of the multi-agency meetings that takes priority or precedence. Funding is always a precarious area, and that can have an impact on the structure of services, how long services are in place, but future planning as well. It can impact on the capacity, how many families we can work with, and also the way services are funded through contracts means that those tensions can come without. It can compromise our independence to some degree, and in some people regard us as agents of the state in that way. Also, some of the strengths of charity services that have been well documented have been contested by some research. But what it's important to remember is that charities are part of a diverse sector, so it's difficult to generalise what the strengths are and what works best. So one harmful sexual behaviour service within Barnardo's, for example, might be funded and structured entirely different to another harmful sexual behaviour service in Barnardo's.
So now we're going to look at the prevalence and specific considerations to children and families within Black, Asian and ethnic minority groups. One of the questions that we were asked prior to this was to discuss the prevalence of Black, Asian and ethnic minority groups affected by sibling sexual abuse. However, when we have researched this, we found it extremely difficult to be able to provide that information to you today. The reasons for that is because there's variations in the way that research designs in terms of child sexual abuse generally. So it's really difficult to give an estimate over the prevalence of child sexual abuse. And there's lots of reasons for that, which I'm sure have been spoken about today. So thinking about the hidden nature and the stigma associated with child sexual abuse, and the fact that many victims and survivors of sexual abuse or sibling sexual abuse may not disclose for many, many years. And also in data that is collected about child sexual abuse, what we find is that there may not be specific information about the relationships between siblings, or the child harmed and the child causing the harm. So we may be able to see that there's been cases of harmful sexual behaviour, as we call it. So when a child harms somebody else, but we may not necessarily be able to see the relationship or even the ages of those people. So what we find as well is that in terms of when data is collected, it's quite generalised. So, for instance, in the Hackett et al. 2013 study into harmful sexual behaviour in Britain and services, they identified that 93% were white, 1% were black, 3% were Asian, and 3% were mixed race. When you think about the broad diversity of different ethnicities and cultures within the UK, it doesn't give us specific information about who those people were and what the prevalence was within those different groups. So what we know as well is that in terms of representation in sort of social care, there's a underrepresentation of Black, Asian, and minority ethnic backgrounds. There's not necessarily there seems to be more young people from mixed race groups rather than those groups, and there's lots of reasons for that. So it's really difficult for us even to know the true extent of child sexual abuse. It's even more difficult for us to be able to give you a breakdown of sibling sexual abuse and the impact versus within the different ethnicities and cultures. So what we thought we'd do today is just to bring in a case study. We've come together as practitioners and we've created a case study. It's a composite case study, a mixture of lots of different families that we've worked with, and we've called it the Nice Family. And what we have here is AJ, 14 years old, non-white, English isn't first language, seeking asylum. The allegation that there's been an allegation of sexual touching of a 9-year-old sibling under clothing. Children's social care are involved. AJ is accommodated in Section 20, and is in foster care, and there's a child protection plan for sibling. We received the referral from for a HSB assessment, so harmful sexual behaviour assessment and intervention support. So the aims and outcomes of that support will be to undertake a specialist assessment of AJ and family, support the safety planning, inform the child protection planning and reunification decisions. One of the key factors that we see is that there's some apprehension about the service, and we also see that there's often no specific support in place for the sibling or the mum at the time of those referrals.
So one of the things that we needed to consider when we work with families is that there can be internal barriers to disclosure and to seeking support. If we look on the left, there's a number of comments that were made by AJ and his family. One of the things is his sibling told a teacher and was afraid to tell their mother. There was comments by the family about AJ bringing shame onto the family. AJ was reluctant to speak about family life and was silent in times during sessions. Mother was afraid of anyone else finding out in the community, and mother hadn't really considered sexual abuse as an issue, and thought that the family thought that AJ and his sister were just being curious. Now, these are all internal things that you wouldn't necessarily know about. And on the right, we've got the kind of things that maybe you need to think about as a worker. When you think about those internal barriers, there's for children, and there can be a fear of being punished or rejected. There can be a fear of being disbelieved or ignored. I think for Black and multi-ethnic families, there can be pressure within families and communities to maintain honour and prevent shame, both for females and children in the family, but also for the community generally. There can be a pressure to conform to cultural norms that can affect children's behaviour and their ability to disclose. And there can be issues around purity for girls and women and masculinity for boys and men. And for a lot of families, there can be a lack of understanding and awareness of concepts such as child sexual abuse, which can again get in the way of them seeking support and actually even having discussions about the issue. Now, if we think about external barriers, and these are things around the family that can affect their ability to engage and for services to engage with them. Now, for AJ and his family, one issue was poverty. They were living in poor housing, and where AJ and his sister had to share a room. So that obviously affected their ability to safety plan for the adults in the family. Now, one of the things that came out was there's an issue about the cultural competency of professionals in relation to understanding their culture, and for the family of understanding what was out there, what kind of services were right for them, and actually whether there were even services for them. One key issue was immigration status. We found there's a worry about engaging with professionals where there can be a concern that engaging with the police or other agencies such as children's social care can lead to there being an effect on people's ability to actually remain in the UK. There can be communication problems due to different languages, different interpretations of behaviour and understandings of behaviour due to religion. There can be a distrust of services and a limited awareness of services. A lot of BAME communities have negative experiences of working with statutory agencies. And obviously, and one of the main ones there can be issues around racism and unconscious bias, which is something that my colleague Michelle is going to talk about.
Thank you, Ray. So when we think about unconscious bias, what we need to recognise is the impact that this has on responses to child sexual abuse generally. Unfortunately, we don't have time to go into great detail about unconscious bias, but we wanted to raise some of the issues within this area that impact on children and families that we've worked with. So adultification bias is where children are identified as from certain communities as being more streetwise, older, mature, and therefore seen as less vulnerable. And within that, they can also be seen as more risky, more dangerous, rather than, as I said, being seen as vulnerable and in need of support. Overlooking child protection concerns and dismissing it as culture. So what can happen is where, complaints are made by children or members of the community or members of a family, and they're dismissed as part of the culture. So it's almost like we're allowing them to, causing harm without challenging it. One of the reasons that this happens is due to fear of stereotyping, being seen as racist or insensitive. And what that can lead to is an overgeneralization. So when people say, well, I don't see race, I don't see colour, actually what that means is that it's a generalised one-size-fits-all approach, and actually misses or fails to recognise the impact and the influence of somebody's culture, their religion, and on their parenting practices, or the roles within that family and the pressures within that family from those, from being part of that community. What we see from research on the impact of an unconscious bias on children and families and communities is that unhelpful stereotypes are applied, and that means missed opportunities and failures to respond to child sexual abuse. And what happens with that is that as organisations, we simply aren't looking for it, and that means that we may not provide the support, the processes that people need to be able to even talk about it. But equally, that can lead to us not being able to communicate that these problems, that families or children may be experiencing sexual abuse, so they themselves can't recognise it. And this can all have an impact on disclosure. So we know that child sexual abuse is underreported generally, but some of these factors, unconscious bias that feeds into communities, can really have a negative impact on people's ability, children's ability to even disclose that abuse. And one of the from research, what we can see is there's disproportionate representation of Black and Asian groups, some Black and Asian groups within the youth justice system. There's many other factors for that, as well as unconscious bias, but it's an important consideration, and it feeds into the adultification bias that I mentioned earlier, where children from certain groups are actually seen as more dangerous and more risk averse and more risky, and therefore they receive a more punitive response rather than a therapeutic. We also see high rates of school exclusions, which have long-term outcomes for children. And there's, for instance, high rates of children from the gypsy and traveller communities that face school exclusions in others. So one of the ways that we see this in our work is that we recognise that children and young people all children and young people who display harmful sexual behaviour have certain vulnerability factors. And when there's unconscious bias, these factors can often be missed or disregarded. So, for instance, our arrows point to some of the incidences that, within our case study that AJ and his family had experienced. But if professionals working with the family and even the family themselves aren't asked for information, or there's assumptions made, then those can be missed. So, for instance, racism is often missed. People often do not ask about families' experiences of racism, or there may be barriers for those families to even speak about racism and their experiences of that. Bereavement. So understanding the impact of bereavement, and not just considering people in the household, but considering wider family members within that and the impact that can have. So there's lots of considerations when you work with children who display harmful sexual behaviour, and it's important when we work with any child, but particularly children from Black, Asian, and ethnic minority groups, that we really get to understand the whole family, their culture, the community, to better understand the child that's harmed.
So when we think about what we've learned from practice with young people like AJ, as Michelle says, it's really important to understand the whole family, the family dynamics, the roles within the family, the expectations. There's been a number of times when we've worked with children and young people who very significant adults, both within the family and outside the family, are unknown. They can sometimes be fathers, grandparents, who are living in other countries or in other parts of the country who our professionals just haven't asked about. One of the working with interpreters is essential. We found that sometimes there can be misunderstanding about language, about sex and sexuality, and about sexual roles, and which need to be checked out directly with families. And the only way to do that is to talk to them in their first language. Number of issues about unresolved and unknown trauma. We found in our work that there's a number of children and young people who've been suffering with post-traumatic stress disorder, or have issues such as being on the autistic spectrum, and this has been undiagnosed. Alternatively, there's been diagnoses made in other countries which haven't been accepted in the UK, and sometimes that's because families have found it really hard to engage with health services. There can be cultural barriers and norms, and which affect children and young people's behaviour that need to be thought of in relation to sex and sexuality. For some Black and Asian young men, there can be issues around them being, and the terminology they would sometimes use is bigged up for being overtly sexualized towards young women. And for some young women, there can be issues of purity and of maintaining their options for marriage, which can affect their behavior, but also affect how families will engage with services around sexual abuse. Obviously, we've talked about racism and aggregating factors such as racial discrimination and racial harassment, both within school and in the community, which can limit a child or young person, such as AJ's, opportunities to have girlfriends and to meet his needs in healthy ways. Professional responses and influences of unconscious bias we've already talked about, but for some families there can be issues about shame, stigma and family honour, which affect their ability to engage with services, and are all things that families need to be given the opportunity to talk about. And again, accessibility can be affected by the prior experiences that families have had of using services. And in AJ's case, and in other young people that we've worked with, that's been a major issue in relation to them feeling that certain services were not for them and are not for Black and Asian and minority ethnic people.
So some specific considerations when working with sibling sexual abuse. It's really important for professionals to be curious and to challenge assumptions. And that's not just within families, but that's for the professionals. It's really important that we recognise that we do need to challenge this within other professions as well as ourselves. Ensuring that we're not placing too much reliance on parents to protect all siblings, because this can lead to overload, particularly when you consider what other barriers and other obstacles they may be having to deal with at the same time. And important to consider what other support is available to parents or supporting them appropriately so they can support the children and the family without becoming overloaded. It's important that we don't overlook the needs of children by focusing on the needs of parents, and there needs to be a balance. We need to include parents and other people, other family members, but we mustn't then overlook the needs of children. They must stay the priority. Concerns about the child's risks to others overshadowing the risks they're exposed to. So when a child is harmed sibling sexually, what often happens is the risks that that child may or may not pose can often overshadow the risks that they've already experienced and are experiencing. So in our case study with AJ, he was experiencing racism within the community, which was involving a verbal and physical violence, and that was overlooked because it was felt that actually it was minimised or it was overlooked, and that leads to further problems because what we know from research is children who harm are still children in their own right and they need to be protected. So the other thing we've identified in terms of cultural competence, which is evidence within research, is keep an open mind, open and inquisitive mind, avoid comparisons. Every family should be treated individually. Don't apply one information from one family to another. Non-judgmental approaches and knowledge to communities, acknowledging and challenging any preconceptions about communities. So that's individually, as a team, as an organisation. Asking about communities, cultures and traditions, not making presumptions, finding out from those communities, those individual families, what are their traditions and values. Attending events in the community and building working relationships with those in power and influence. We need to start thinking about working preventative work and identifying people within communities who can help us with that. Finding out about specific needs. What needs do they have that are specific to them and within the family, within their communities? Asking questions, exploring the lived experience of their culture. We need to be asking questions. We need to be curious and inquisitive. So what's next for the social sibling sexual abuse provision? So Spencer?
We've seen today some of the key strengths of charity sector responses to sibling sexual abuse. What I want to get across is that we're not saying that the charity sector is in any way superior, but I think that we, instead of focusing on comparing distinctiveness and difference, we need to consider interdependence a bit more and how we can best work with others. So I think the charity sector is integral to responses to sibling sexual abuse, but that is alongside statutory services and also community services, and that's at a tertiary level, but importantly at a primary and secondary level as well. So building up awareness of sibling sexual abuse in primary level services.
And the other thing that we'd like to, we're recommending is that there's more community involvement and there's meaningful engagement and collaboration with those communities, and that they're involved in the design and delivery of harmful sexual behaviours and sexual abuse services. And by involving them, we move away from the individual responses to working with sibling sexual abuse, with harmful sexual behaviour, to more to working within communities, cultures and families. Some really good research that came out of Australia, worked with Aboriginal families affected by harmful sexual behaviour, that highlighted the importance of partnerships and the importance of establishing those partnerships and community relationships early rather than working, dealing with a crisis response. So thank you for listening to us today. If you'd like more information about our services that are on offer from the Barnardos and the NSPCC, we have lots of resources available on our website and detailing our services and other information that you can access about sibling sexual abuse and considerations for work with Black, Asian and ethnic minority groups. Thank you.
Thanks, Al.
Thank you.